Want to learn exactly what an accredited breast center is? We're going to teach you all about it. When you're diagnosed with breast cancer, you will get the best care when your breast specialists work together as a team to attack your breast cancer. And this team approach is the foundation of NAPBC, Nationally Accredited Breast Centers, and is the future of quality, comprehensive breast cancer care. In this lesson, we will teach you what an NAPBC accredited breast center is, why a multidisciplinary breast cancer team is so important for you to get quality breast cancer care, and why a patient navigator is so helpful to you. I'll also teach you how to find an NAPBC accredited breast center in your area. So let's get started. What is an accredited breast center? Think of a breast center as a place where your breast specialists work together as a team, focused solely on you to get you the very best breast cancer outcomes. A breast center can be a freestanding building, which is actually somewhat uncommon. Most of the time, a breast center is located within a hospital or hospital system, and there's some offices and services in one place, and other services are utilized that might be located elsewhere. An NAPBC accredited breast center includes a number of things. Most importantly, a multidisciplinary team, breast surgeons, medical oncologists, radiation oncologists, radiologists, plastic surgeons, pathologists, to focus on you to make sure we're not missing anything and make sure we add in every possible option for treating your cancer. As important as that multidisciplinary team for you is a patient navigator, a breast center patient navigator, who knows how to walk you through this journey going to different doctors, different treatments, in and out of the hospital, which is arduous and frustrating in and of itself. A patient navigator also can guide you to services and help identify things that you might need that your physicians may not think about or have the time to address. A breast center also has supportive services, an array of them, such as lymphedema therapy or physical therapy or nutrition or psychological help for many that go through this difficult, long journey of breast cancer treatment. So an NAPBC, Nationally Accredited Program for Breast Centers, accredited breast centers met all of the criteria and guidelines that show that they are providing excellent, quality, organized, and multidisciplinary breast cancer care. What is a multidisciplinary breast cancer team? Well, breast cancer treatment can be complicated. Most times, decision processes for early stage breast cancer are fairly straightforward, although there are some twists and turns that a multidisciplinary team can bring to the table to help a patient and improve their choices and outcomes. But especially when you have a complicated breast cancer situation, pulling everyone together as a team, tossing out ideas, bringing up new cutting-edge advances, offering clinical trials, offering other services, or people have seen different aspects of a patient from a different perspective, meaning your surgeons talking to your medical oncologist who's talking to your radiation oncologist. And the radiation oncologist wants to see the patient before surgery because it's a big tumor. They're not sure how big it will be after they finish chemotherapy. We learn from one another. And so your breast specialists, when they're engaged in a multidisciplinary team, in my opinion, I started a breast center years ago. I became a better doctor, a better physician. I knew more. I learned from my colleagues. Being a surgeon, I learned about medical oncology aspects, and chemotherapy and hormonal therapy. I learned from the other surgeons, and I learned from the radiation oncologists and the nurses and the patient navigator. And when you put people that are dedicated to learning more each day, rather than just sitting in their office doing their thing and passing patients along, you benefit in the end if you get your care with a team that works together with others. And that is why a multidisciplinary team is the foundation and the heart of an accredited breast center. What is a breast patient navigator? Well, every accredited breast center has a breast patient navigator who is your personal advocate from diagnosis through your entire treatment within that breast center. Think of a patient navigator as someone that's specially trained that knows the pathway and the different steps of breast cancer care, from surgery to chemotherapy, hormonal therapy, radiation therapy, and everything in between. They are your concierge service to navigate through to your doctors, get appointments by calling the back line. They know how to do it. They know how to expedite getting MRIs, CAT scans, bone scans, and other services. They also talk to you on a different level than your doctors. They really get to know you. And sometimes patients share with the patient navigator more than they share with the doctors, or with the patient navigator identifies problems or needs for patients that doctors don't. So a patient navigator works with your physicians and your multidisciplinary team to make sure you get the very best care possible in your community. How do I find an NAPBC accredited breast center? Well, you know as well as I, it's very easy to look something up on the phone or the computer and you can Google the terms. What I would suggest is that you work to find where in your community you have a breast center and a group of people working together. I think some of the red flags are if you're in a community, there's a breast center, but a doctor that's not participating when they have the opportunity to. It's worth asking them why they don't participate in the breast center. And if they kind of feel like a breast center is not helpful or it doesn't add much, in my opinion, it's a bit of a red flag for the quality of care that you will get with that physician. So you're savvy enough to look and find breast centers and accredited breast centers, but if you have a choice between an accredited breast center and something that's called a breast center, the take-home message is pick the accredited breast center. To learn more about NAPBC accredited breast centers, visit the Breast Cancer School for Patients. We teach you everything you need to know. We're here to help you get the best possible breast cancer care in your community. Register on our website to get our list of questions to prepare you for your next doctor visit.